Hello, I am Dr. Ronnie. I am a doctor of physical therapy, and I specialize in working with people with chronic pain and chronic conditions and general wellness. So, people who maybe just don't feel like they're at their peak functioning and they just want to live sort of a better life. And I am starting this YouTube channel today, even though it is completely out of my comfort zone. But if I wait until things are perfect, then I will never do it. So I was encouraged by a great group of ladies to get started and to just kind of get out of my comfort zone and get out there. So I much prefer in person, and I like that sort of in-person connection, but I realize, there's a lot of people who are looking for information online, and that this might be one of the best ways to connect to people and educate people. And particularly, a lot of people that I sort of see and work with may find it difficult to leave their houses, or it may be difficult for them to get out to something that is in person. So I think that this could be like a really great setting for a lot of people who are just sort of looking for some information. They're not ready to leave their houses, or maybe it's too difficult for them to actually leave their house and interact on that level. So I wanted my first video to be a little bit of an introduction about myself, and also to talk about my vision for this channel and kind of some of what my goals are here. So I will start a little bit about just some of my background. So I've been a physical therapist for 10 years, and I started my career in travel therapy, which is if you know anything about physical therapy or grad school, one of the things that they often tell new grads is definitely do not start in travel, because you will get walked all over and it will be so challenging. You'll be all alone. You won't have a team. It'll be way too difficult to get started. So I said, screw that. I'm going to do travel therapy. So I just kind of wanted something different. And I really wanted to travel a little bit and see what all was out there. And I think it really ended up being the absolute perfect thing for me to do, because it allowed me to see the healthcare system from multiple different angles. So I was able to work in multiple different settings, multiple different places in the country, and experience a lot of different perspectives on healthcare. So seeing how different systems work in California, in Texas, in Missouri, in various different places, how they're the same across the United States and how they're different. So what it allowed me to do, I think, is to really have sort of this bird's eye view, and also to not get stuck in any one sort of area of practice, or to just think that one way is the way that things are. So I think it was really a good thing, because then it allowed me to sort of not get pigeonholed into some of the traditional ways of doing things. And that is really where my practice developed to include chronic pain, chronic conditions, and that's how it kind of became my focus. My background, the school that I went to, has laid an amazing foundation. They're really focused on mechanical and biomechanics, which I think is probably the best foundation that you could have as a physical therapist, because there is the absolute analogy that you can see that our bodies are kind of like machines, right? So there are ways that are sort of these textbook versions of the way that our body is supposed to move. And speaking from a kinesiology, physiology, and sort of mechanical, biomechanical perspective, there is sort of these ideal ways that our body moves that works for a lot of people. So if you have that really excellent foundation, it is going to help a lot of people. And in my experience looking at different ways that people practice physical therapy, there are a lot of physical therapists who don't have that really good foundational knowledge of how the body works in sort of like a textbook way of biomechanics. If you know biomechanically how the body works, then you can change someone's biomechanics, how they're actually presenting, to maybe something that's a little bit more ideal. So I can do a whole video about that. I'm not going to get deeper into it today because that is a whole can of worms. But I think that basically that I have this really, I'm really grateful for the foundation that I have in that. But what I was running into a lot in going to all these different settings is there's still a population of people that these sort of run-of-the-mill traditional things do not work for. Um, and everybody with these perspectives has, oh, well, you just didn't do it right or something, or you didn't go deep enough into the exam uh, or into the practice of it. So I don't think that's true, and I've learned that over time. One of the patients that kind of comes to mind a lot that really started shifting my perspective in moving towards, there's something else going on here. We can't just look at biomechanics. It's not enough. Is one patient that I had when I was practicing in Texas, and she had chronic back pain. She had pain that went down her legs. She had some numbness and tingling that went down into her legs. And I'd been working with her for a long time. She was an active person. She was a pretty lively, like energetic, funny lady. And what ends up happening sometimes is people with chronic pain, chronic conditions, they start getting labels attached to them. Um, like even the word chronic is kind of like a label that gets attached to people, and then it's like, oh no, right? So, and then they start experiencing these traditional kind of things in the healthcare system that are really not beneficial to them. So sometimes they get labeled as treatment resistant or chronic, or um, like the worst would be like a malingerer, so somebody who's trying to like milk the system or something, or trying to um, get out of work or something like that. But they're faking or something, or it's all in their head, and that is probably one of the worst labels that I've heard. And but this lady, like, it's obvious, most of the people, 99.9% of the people that I see that have chronic conditions, they're not trying to get something out of the system. They're not trying to get attention, they're not trying to get money. They're trying to get help. They're trying to get better. And when they keep going through all these interventions over and over and over and over again, even they maybe start to think like, oh my God, am I just really crazy here? Or like, does everybody think I'm crazy? So I kept running into people like this. I would do this biomechanical exam. I would do every modality under the sun. Like, let's get them on a heat pack. Let's do e-stim. Let's do ultrasound. Let's do this. Like, just throw the kitchen sink at them because nothing is getting better. Well, what if I tried a different method? What if, the method I was taught in school, like, isn't for everybody? Like, maybe I need to try this school of thought or that school of thought, and ultimately all these things weren't solving the problems. Um, you throw the kitchen sink at these people and they're still in pain. Is it because they want to be in pain? No, like nobody wants that. It's horrible. People want to live their lives. They want to do the things that they want. They want to spend time with their family. They want to hike. They want to do hobbies. They want to be happy, right? That's what we all want. So what I kept running into time and time again is that this sort of very cookie cutter kind of system, whether it's this cookie cutter or this cookie cutter or a combination of the two, still really wasn't cutting it. So I over time was able to, by doing travel therapy, I was able to see this sort of from a bird's eye view, that this is what's going on kind of all over the place. And I finally, eventually, in my travels, was able to come to a place where that wasn't so much the case. When I settled for a while at a place in Oregon, there were a lot of healthcare providers there that were not convinced of this cookie cutter thing, that they were very patient focused, they were person centered, and they were questioning some of these traditional methodologies. Not that they weren't using them, absolutely, we do. Um, but looking at what else is there and what is the research saying specifically about the conditions that these people have, and what is the research saying about how effective are certain modalities, and maybe they aren't as effective as we like to think they are, and that the research isn't actually there for them. So if the research isn't there for some of these traditional modalities for certain kinds of people, then where does the research point? And that's where I started developing my focus into working with people with chronic pain and chronic conditions, and really reading into the research about these things in relation to pain science. And it really opened up my perspective a lot. Again, using this as like another tool in the tool belt, that some of those other modalities definitely 100% are still necessary, but relying on them as your sole tool is going to be ineffective. And a lot of these people have already had that same tool used over and over and over and over and over again. And lots of people with chronic pain and chronic conditions have been to physical therapy a ton. So they already know, like they've got their 2 sets of 10 worksheet that they've been doing every single day for 2 years. It's not that they're not working on it; they're working very hard on it. But why is it not improving their quality of life? Why are they not getting better? And there are lots of underlying factors that play into it. So that kind of brings me to my goal for this channel, or my vision for this channel, is to bring education to people about wellness, about chronic pain, about chronic conditions, and some of the underlying factors that maybe get ignored or don't get talked about as much, or maybe that the practical information isn't there. I think a lot of us now know, okay, self-care is really important, but how do I practice self-care that works for me? Like, or that fits into my lifestyle. Sometimes we think self-care is like mani-pedis and a hot bathtub or something, and then you've got people who are like, I hate that, or I can't get in and out of a tub, or I've got 5 kids, where would I find the time to do that? So these things aren't always practical. You see all these cute little things on Pinterest or Instagram or something, uh, that are like all these self-care ideas. But for some people, those aren't it, right? So I want to talk about, um, what are what in research is there that points towards these underlying factors that influence chronic conditions, and how can we target them? How can we get at sort of some of these more root causes, and really tap into how to use those, as a tool in our tool belt. And so I want to get information out there for people who maybe don't have that information. I also really want to increase health literacy. I think that our culture in general is becoming much more health literate, but I also feel that there are a lot of areas in the country that it isn't, and that doctors sometimes talk over people's heads, or there's not that ability to communicate very well with a healthcare provider, as a patient or as a client, and that maybe there's a lot of disconnect, that sometimes patients feel like their healthcare provider isn't listening to them. And sometimes I do think it is a communication issue, that you're not really speaking the same language, even though you are, that there's the healthcare language, and then there's the person language. There's the lay, like language that we all use, and they don't always connect. So finding that balance between those. And, full transparency, I also really hope that after people, get some of this information, that they maybe want to work with me, that they want to come talk to me in person and maybe do one of my programs, or just kind of learn, a few sessions. I don't want to be a YouTuber. That's not my journey in life. But I am hopeful if this is a bridge for people that they see me, that they understand kind of where I'm coming from and what my vision is and what my goals are. That maybe they'll feel inspired to take a step in a system that they feel like they've been ignored, or not heard, that maybe they can have hope again, that there is something out there, that they can make a change in their lives, or that their life can be better in some way. So that's my goal. Like I said, I don't want to be a YouTuber. I want to work with people in real life. I want to build connections. I want to build something that's meaningful and make meaningful connections with people. And so, with that, I am going to turn it back to whoever might be listening to this, and ask, what are some topics that you want to hear about? Is there a chronic condition that you want to know more about? Is there some kind of research thing that you heard that you say, hey, I heard this was great for chronic pain, or I heard that this was good for, high blood pressure, or something like that. What is something that you want to know more about, that you would want to hear about? Or maybe you want to hear more about physical therapy, and traditional versus non traditional methods, or supplemental methods, or more about the science behind pain and chronic conditions. So I'm turning it back to you. I'm asking you, what do you want to hear more about? Let me know in the comments. And if you're watching this video, I hope that you subscribe and like, because I hear that's important. And then you can stay up to date with everything that I've got going on. So thank you for watching, and I hope to be back here again.